Welcome to the NCLEX-RN Practice Test, Health Promotion and Maintenance Part 1. This quiz contains 50 questions to help you prepare for the NCLEX-RN exam. Let's get started. Question 1. A nurse is reviewing the CDC immunization schedule with the parent of a 2-month-old infant. Which vaccines should the infant receive at this visit according to the standard schedule? Option A, MMR, varicella, and hepatitis A. Option B, DTaP, IPV, HIB, PCV13, RV, and hepatitis B. Option C, staph, HPV, and meningococcal. Option D, influenza, pneumococcal, and hepatitis A. The correct answer is B. At 2 months of age, infants receive their first doses of DTaP, diphtheria, tetanus, acellular pertussis, IPV, inactivated poliovirus, HIB, Haemophilus influenza type B, PCV13, pneumococcal conjugate, RV, rotavirus, and the second dose of hepatitis B, first dose given at birth. MMR and varicella are given at 12 to 15 months. Staph, HPV, and meningococcal are adolescent vaccines. Influenza can start at 6 months. Question 2. A nurse is preparing to administer vaccines to a 12-month-old child. The parent reports the child had a severe allergic reaction, anaphylaxis, to a previous dose of the MMR vaccine. What is the nurse's priority action? Option A, administer the MMR vaccine in a different injection site. Option B, hold the MMR vaccine and notify the healthcare provider. Option C, give half the dose to reduce allergic response. Option D, administer an antihistamine before giving the MMR vaccine. The correct answer is B. A severe allergic reaction, anaphylaxis, to a previous dose of a vaccine is a contraindication to receiving that vaccine again. The nurse should hold the MMR vaccine and notify the provider for further evaluation. Administering the vaccine could cause life-threatening anaphylaxis. Giving antihistamines prophylactically is not appropriate for known contraindications. Question 3. A 28-year-old pregnant woman at 10 weeks gestation asks the nurse which vaccines she can safely receive during pregnancy. Which vaccine should the nurse identify as CONTRANDCTD during pregnancy? Option A, inactivated influenza vaccine. Option B, staph vaccine. Option C, MMR, measles, mumps, rubella vaccine. Option D, hepatitis B vaccine. The correct answer is C. MMR is a live attenuated vaccine and is contraindicated during pregnancy due to theoretical risk of fetal harm. Pregnant women should receive inactivated influenza vaccine any trimester and staph during each pregnancy, ideally 27 to 36 weeks, to protect both mother and newborn. Hepatitis B is safe if indicated. Women should avoid pregnancy for 4 weeks after receiving live vaccines. Question 4. A nurse is caring for a 5-year-old child newly diagnosed with acute lymphocytic leukemia, ALL, who will begin chemotherapy next week. The child's immunization record shows they are up to date. Which vaccine should the nurse anticipate will need to be avoided during and after chemotherapy? Option A, inactivated influenza vaccine. Option B, live attenuated influenza vaccine, LAIV. Option C, hepatitis B vaccine. Option D, IPV, inactivated poliovirus vaccine. The correct answer is B. Children with leukemia receiving chemotherapy are severely immunocompromised. Live vaccines, LAIV, MMR, varicella, rotavirus, are contraindicated in immunocompromised patients due to risk of uncontrolled viral replication and severe disease. Inactivated vaccines, Influenza injection, hepatitis B, IPV, are safe, but may have reduced immune response. The nasal spray flu vaccine, LAV, is live and must be avoided. Question 5. According to the CDC adolescent immunization schedule, which vaccines are routinely recommended at the 11 to 12-year-old well-child visit? Option A, DTaP, IPV, and MMR. Option B, STAP, HPV, and MenACWY, meningococcal. Option C, HIB, PCV13, and rotavirus. Option D, hepatitis A and varicella. The correct answer is B. The 11 to 12-year visit is the primary adolescent immunization visit. STAP booster, tetanus, diphtheria, pertussis, is given if not received previously. HPV vaccine series can start at age 9. MenACWY, meningococcal conjugate, is given at 11 to 12 with booster at 16. DTaP, IPV, MMR, HIB, PCV13, and rotavirus are childhood vaccines completed by age 6. Hepatitis A and varicella should be given earlier, 12 to 23 months and 12 to 15 months respectively. Question 6. A 67-year-old patient asks the nurse about recommended vaccines for older adults. Which vaccine should the nurse identify as specifically recommended at age 65? Option A, HPV vaccine. Option B, pneumococcal vaccine. Option C, meningococcal vaccine. Option D, rotavirus vaccine. The correct answer is B. Adults age 65 and older should receive pneumococcal vaccination, PCV15 or PCV20, followed by PPSV23 if PCV15 given. This protects against pneumococcal pneumonia, bacteremia, and meningitis. HPV is recommended through age 26, shared decision-making 27 to 45. Meningococcal is for specific risk groups, not routine at 65. Rotavirus is an infant oral vaccine only. Question 7. A nurse is preparing to administer the MMR vaccine to a 12-month-old child. Which route and site should the nurse use for this vaccine? Option A, intramuscular, IM, in the vastus lateralis. Option B, subcutaneous, SQ, in the outer upper arm or thigh. Option C, intradermal in the forearm. Option D, oral administration. The correct answer is B. MMR and varicella vaccines are administered subcutaneously, SQ. For infants and toddlers, the anterolateral thigh is preferred. For older children and adults, the outer upper arm, triceps area, is used. Most other vaccines, DTaP, hepatitis, HIB, PCV, IPV, are IM. Rotavirus is the only routine oral vaccine. Question 8. A parent tells the nurse, "My child has a severe egg allergy, so they can't get the flu shot." What is the nurse's best response? Option A, you're correct. Children with egg allergies should never receive influenza vaccine. Option B, your child can receive any influenza vaccine, but should be monitored for 30 minutes after administration. Option C, your child can only receive the nasal spray flu vaccine, not the injection. Option D, your child needs to see an allergist before receiving any vaccines. The correct answer is B. Current CDC guidelines state that people with egg allergy of any severity can receive any influenza vaccine, egg-based or egg-free, that is otherwise appropriate. Those with severe egg allergy anaphylaxis should be vaccinated in a medical setting supervised by a provider able to manage severe allergic reactions with 30-minute observation. Egg allergy is not a contraindication to flu vaccine. The nasal spray, LAV, has specific contraindications unrelated to egg allergy. Question 9. According to the CDC adult immunization schedule, at what age should adults begin receiving the Shingrix recombinant zoster vaccine? Option A, age 40. Option B, age 50. Option C, age 60. Option D, age 65. The correct answer is B. Shingrix recombinant zoster vaccine is recommended for all immunocompetent adults age 50 and older, given as 2 doses 2 to 6 months apart. It is also recommended for adults 19 plus who are or will be immunocompromised. This is earlier than the previous Zostavax recommendation of age 60. Shingrix is more effective, greater than 90%, and is now the preferred zoster vaccine. Question 10. A nurse discovers that the refrigerator containing vaccines lost power overnight and the temperature rose to 15 degrees Celsius 59 degrees Fahrenheit for 8 hours. What is the nurse's priority action? Option A. Administer the vaccines as scheduled since they were only warm for one night. Option B. Discard all vaccines immediately without further assessment. Option C. Quarantine the vaccines, document the temperature excursion, and contact the vaccine manufacturer for guidance. Option D. Transfer the vaccines to another refrigerator and continue using them. The correct answer is C. Vaccines are temperature-sensitive biological products. When a temperature excursion occurs, vaccines should be quarantined, marked Do Not Use, the incident documented, and the manufacturer or health department contacted for guidance on viability. Some vaccines may still be usable depending on the specific product, temperature, and duration. Never use potentially compromised vaccines without guidance, but don't automatically discard expensive vaccines without assessment. Question 11. A pregnant client's last menstrual period, LMP, began on March 15th. Using Naegele's rule, what is the estimated date of delivery, EDD? Option A, December 8th. Option B, December 22nd. Option C, January 8th. Option D, January 22nd. The correct answer is B. Naegele's rule calculates the EDD by adding 7 days to the first day of the LMP, subtracting 3 months, and adding 1 year. March 15th plus 7 days equals March 22nd. March 22nd to 3rd months equals December 22nd. Question 12. The nurse is teaching a pregnant client about normal weight gain during pregnancy. The client has a pre-pregnancy BMI of 22, normal weight. What is the recommended total weight gain for this client? Option A, 15 to 20 pounds. Option B, 25 to 35 pounds. Option C, 28 to 40 pounds. Option D, 35 to 45 pounds. The correct answer is B. The Institute of Medicine recommends a weight gain of 25 to 35 pounds for women with a normal pre-pregnancy BMI, 18.5 to 24.9. Underweight women need more, 28 to 40 pounds, and overweight/obese women need less, 15 to 25 pounds or 11 to 20 pounds. Question 13. A pregnant client at 16 weeks gestation reports feeling fluttering sensations in her abdomen. She asks the nurse what this means. Which response by the nurse is most accurate? Option A, this is called quickening, and it's the first time you're feeling your baby move. Option B, these are Braxton Hicks contractions, which are practice contractions for labor. Option C, this sensation indicates your baby is in distress and needs immediate evaluation. Option D, you're experiencing gas bubbles, which are common during the second trimester. The correct answer is A. Quickening, the first perception of fetal movement by the mother, typically occurs between 16 to 20 weeks gestation. This is a normal and expected milestone in pregnancy that indicates fetal well-being. Question 14. A laboring client is in the second stage of labor. The nurse observes the fetal heart rate tracing shows variable decelerations with each contraction. Which intervention should the nurse implement first? Option A. Increase the oxytocin infusion rate. Option B. Reposition the client to her side. Option C. Prepare for an immediate cesarean section. Option D. Document the finding and continue monitoring. The correct answer is B. Variable decelerations are caused by umbilical cord compression. The first intervention is to reposition the client, typically to the side, to relieve cord compression. This is a non-invasive intervention that should be attempted before more aggressive measures. Question 15. A client at 39 weeks gestation arrives in labor and delivery reporting regular contractions every 3 to 4 minutes. On examination, the cervix is 6 centimeters dilated, 100% effaced, and the fetal head is at +1 station. The fetal heart rate baseline is 145 BPM with moderate variability and occasional accelerations. The client requests an epidural for pain management. Which action should the nurse prioritize before initiating the epidural? Option A. Obtain a complete blood count, CBC, to assess hemoglobin and hematocrit levels. Option B. Administer a 500 to 1,000 milliliters 4 fluid bolus of lactated Ringer's solution. Option C. Perform a sterile vaginal examination to confirm cervical dilation. Option D. Obtain informed consent and document the client's understanding. The correct answer is B. Before epidural placement, a fluid bolus, 500 to 1,000 milliliters, is administered to prevent maternal hypotension, a common side effect of epidural anesthesia. The vasodilation caused by the epidural can cause significant blood pressure drops. Preload optimization helps maintain hemodynamic stability. Question 16. A postpartum client delivered a healthy newborn 2 days ago. The nurse assesses the fundus at 1 centimeter below the umbilicus and notes moderate lochia rubra. Which action should the nurse take? Option A. Document the findings as normal for this time period. Option B. Notify the healthcare provider immediately for possible hemorrhage. Option C. Massage the fundus until firm and reassess in 15 minutes. Option D. Encourage the client to ambulate to expel retained clots. The correct answer is A. On postpartum day 2, the fundus should be approximately 1 to 2 centimeters below the umbilicus. Lochia rubra is expected for the first 3 to 4 days postpartum. These findings are within normal limits and require only documentation. Question 17. A postpartum client on day 3 after an uncomplicated vaginal delivery presents with the following assessment. Fundus firm at 2 centimeters below the umbilicus, lochia serosa with a mild earthy odor, and a small area of redness on the left breast that is warm and tender to touch. The client reports feeling overwhelmed and has been crying intermittently for the past 24 hours. Which finding requires the most immediate nursing intervention? Option A. The fundal position at 2 centimeters below the umbilicus. Option B. The lochia serosa with a mild earthy odor. Option C. The red, warm, tender area on the left breast. Option D. The intermittent crying and feeling overwhelmed. The correct answer is C. The red, warm, and tender area on the breast suggests mastitis, which requires prompt intervention with antibiotics and continued breastfeeding. Untreated mastitis can lead to abscess formation and systemic infection. This finding requires the most immediate nursing intervention. Question 18. The nurse is preparing to assess a newborn's APGAR score at 1 minute after birth. Which 5 parameters are evaluated in the APGAR scoring system? Option A, airway, pulse, grimace, activity, respiratory effort. Option B, appearance, pulse, grimace, activity, respiratory effort. Option C, alertness, pulse, grimace, activity, reflexes. Option D, appearance, perfusion, grimace, activity, respirations. The correct answer is B. APGAR stands for appearance, skin color, pulse, heart rate, grimace, reflex irritability, activity, muscle tone, and respiratory effort. Each parameter is scored 0 to 2, with a total score ranging from 0 to 10. Question 19. A newborn has the following assessment at 1 minute after birth. Heart rate 110 BPM, weak cry with some flexion of extremities, vigorous cry when stimulated, body pink with blue extremities, and respiratory rate of 40 breaths/minute with a strong cry. What is the correct APGAR score for this newborn? Option A, 6. Option B, 7. Option C, 8. Option D, 9. The correct answer is C. APGAR scoring, appearance, pink body, blue extremities, equals 1, pulse, 110 BPM, greater than 100, equals 2, grimace, vigorous cry when stimulated, equals 2, activity, some flexion, equals 1, respiratory effort, strong cry, 40 BPM, equals 2. Total equals 1 plus 2 plus 2 plus 1 plus 2 is equal to 8. Question 20. A newborn is being assessed at 24 hours of age. The nurse notes a yellowish tint to the skin on the face and chest, but the sclera remain white. The newborn is breastfeeding well, has passed meconium stools, and has a normal neurological examination. The total serum bilirubin level is 10 milligrams per deciliter. The nurse understands that this presentation is most consistent with which condition? Option A, physiological jaundice, a normal variant requiring monitoring only. Option B, pathological jaundice, requiring immediate phototherapy. Option C, breastfeeding jaundice, requiring supplementation with formula. Option D, hemolytic disease of the newborn, requiring exchange transfusion. The correct answer is A. Physiological jaundice typically appears after 24 hours of life, peaks at 3 to 5 days, and resolves within 1 to 2 weeks. A bilirubin level of 10 milligrams per deciliter at 24 hours is within acceptable limits for a term newborn. The absence of scleral icterus, normal feeding, normal neurologic exam, and timing all support physiological jaundice. Question 21. According to Erikson's psychosocial theory, which developmental stage is characteristic of the school-age child, 6 to 12 years? Option A, initiative versus guilt. Option B, industry versus inferiority. Option C, identity versus role confusion. Option D, autonomy versus shame and doubt. The correct answer is B. School-age children, 6 to 12 years, are in Erikson's industry versus inferiority stage. During this period, children develop a sense of competence through successfully completing tasks and receiving recognition for their achievements, which builds self-confidence and industry. Question 22. A nurse is teaching a parent about cognitive development. At which age would a child typically demonstrate conservation of volume, according to Piaget's theory? Option A, 2 years. Option B, 5 years. Option C, 8 years. Option D, 14 years. The correct answer is C. Conservation of volume develops during the concrete operational stage, ages 7 to 11 years. An 8-year-old child can understand that the amount of liquid remains the same when poured into a container of different shape, demonstrating logical thought about concrete objects. Question 23. Which 4 domains are assessed by the Denver 2 developmental screening test? Option A, cognitive, motor, social, and emotional. Option B, personal social, fine motor, language, and gross motor. Option C, physical, intellectual, language, and adaptive. Option D, sensory, motor, cognitive, and communication. The correct answer is B. The Denver 2 developmental screening test assesses 4 specific domains: personal social skills, interacting with others, fine motor adaptive, hand-eye coordination, language, receptive and expressive, and gross motor, large muscle movements. This screening tool helps identify children who may need further developmental evaluation. Question 24. A 19-year-old college student tells the nurse, "I'm trying different majors and joining clubs to figure out who I really am. My parents want me to pick one career path, but I need to explore." According to Erickson, this student is successfully navigating which developmental task? Option A, developing a sense of industry. Option B, establishing a sense of identity. Option C, achieving a sense of intimacy. Option D, building a sense of autonomy. The correct answer is B. This young adult, 19 years, is in Erickson's identity versus role confusion stage, 12 to 18 years, extending into early 20s. The student is actively exploring different roles, values, and career paths, which is the healthy resolution of this stage. This exploration leads to a coherent sense of self and personal identity. Question 25. A 4-year-old child watches the nurse give an injection to her stuffed bear, then tells the nurse, "My bear is crying because he's scared, but I told him it will help him feel better." According to Piaget, this behavior demonstrates which cognitive characteristic of the preoperational stage? Option A, object permanence. Option B, egocentrism. Option C, magical thinking. Option D, animism. The correct answer is D. Animism is a characteristic of the preoperational stage, 2 to 7 years, where children attribute human feelings, intentions, and lifelike qualities to inanimate objects. The child's belief that the stuffed bear can cry, feel scared, and understand comforting words demonstrates animistic thinking. Question 26. During a well-child visit, the nurse observes a 9-month-old infant who is able to sit without support and bangs 2 objects together. The infant cries when the mother leaves the room and shows distress around unfamiliar people. Which statement by the nurse is most appropriate? Option A, your baby's stranger anxiety indicates a need for further developmental evaluation. Option B, your baby is showing expected developmental milestones for this age. Option C, your baby's inability to walk yet suggests a delay in gross motor development. Option D, your baby should be able to say at least 5 words by this age. The correct answer is B. At 9 months, expected milestones include sitting unsupported, banging objects together, hand coordination, stranger anxiety, and separation anxiety. These are all normal developmental indicators. Stranger anxiety typically emerges around 9 months as the infant develops object permanence and can distinguish familiar from unfamiliar people. Question 27. A nurse is caring for a 3-year-old child who was recently toilet trained at home. Since being admitted to the hospital for pneumonia, the child has started wetting the bed and asks to be fed. The parent is frustrated and says, "I don't understand why he's acting like a baby again." Which nursing intervention best addresses this situation? Option A. Explain to the parent that regression is a normal response to stress and the child will resume previous behaviors when comfortable. Option B. Reassure the parent that bedwetting is common and suggest putting the child back in diapers temporarily. Option C. Encourage the parent to maintain strict discipline to prevent the child from manipulating the situation. Option D. Advise the parent that the child needs to be re-toilet trained immediately to prevent long-term problems. The correct answer is A. Regression is a common response to stress, illness, and hospitalization in young children. At age 3, the child is in Erikson's autonomy versus shame and doubt stage. Hospitalization threatens the child's newly gained independence. Explaining regression as a normal coping mechanism reduces parental anxiety and supports the child's emotional needs during recovery. Question 28. A parent brings a 4-year-old child to the clinic for a preschool physical. The child demonstrates the ability to hop on one foot, draw a person with 3 body parts, and use scissors to cut paper. The child's speech is understandable to strangers about 90% of the time. Based on these findings, which anticipatory guidance should the nurse provide? Option A. Refer the child for immediate evaluation by a developmental specialist. Option B. Encourage activities that promote fine motor skills and social interaction with peers. Option C. Focus on academic readiness skills, such as reading and writing letters. Option D. Limit physical activities that may cause injury during this developmental stage. The correct answer is B. The 4-year-old is demonstrating age-appropriate milestones, hopping on one foot, gross motor, drawing a person with body parts, fine motor/cognitive, using scissors, fine motor, and being 90% intelligible to strangers, language. Anticipatory guidance should focus on continuing development through play, peer interaction, and fine motor activities appropriate for preschool preparation. Question 29. A nurse is administering a Denver 2 developmental screening to a 2-year-old toddler. The child is able to run without falling, speak in 2-word sentences, and stack a tower of 6 blocks. However, the child cannot kick a ball forward and does not use the words I, me, or you appropriately. How should the nurse interpret these findings? Option A. The child has normal development in all areas with no concerns. Option B. The child shows delays in both gross motor and language domains requiring immediate intervention. Option C. The child's performance shows areas of normal development and areas requiring further evaluation. Option D. The child's inability to use pronouns indicates a cognitive impairment. The correct answer is C. The child demonstrates age-appropriate skills in some areas: running, gross motor, normal for age 2, 2-word sentences, language, normal for age 2, and stacking 6 blocks, fine motor, normal, as 2-year-olds typically stack 6 blocks. However, inability to kick a ball forward and not using pronouns appropriately may warrant monitoring. Kicking a ball typically develops by 2 years, and pronoun use begins around 2 years. These findings suggest areas that need further assessment or monitoring. Question 30. An 85-year-old patient in a long-term care facility frequently talks about her past accomplishments, her family, and states, "I've had a good life, and I'm ready when the Lord calls me home." She shows no signs of depression and enjoys sharing wisdom with younger staff. According to Erickson, this patient is demonstrating which outcome? Option A: stagnation resulting from inability to adapt to aging. Option B: integrity achieved through successful life review. Option C: despair masked by denial of aging process. Option D: generativity extended into late adulthood. The correct answer is B. This patient demonstrates Erickson's positive resolution of integrity versus despair, 65 plus years. She engages in life review, accepts her life as meaningful, and shows peaceful acceptance of mortality. Integrity involves accepting one's life history, feeling a sense of completeness, and being at peace with approaching death. Question 31. The nurse is teaching a nursing student about normal vital sign parameters for an adult client. Which temperature range represents the normal oral temperature? Option A: 95.8 to 97.2 degrees Fahrenheit. Option B: 97.8 to 99.1 degrees Fahrenheit. Option C: 99.5 to 101.0 degrees Fahrenheit. Option D: 96.5 to 98.0 degrees Fahrenheit. The correct answer is B. Normal oral temperature for an adult ranges from 97.8 degrees Fahrenheit to 99.1 degrees Fahrenheit, 36.5 degrees Celsius to 37.3 degrees Celsius. This range reflects normal thermoregulation and metabolic function. Rectal temperature is typically 1 degree Fahrenheit higher than oral temperature. Question 32. When performing an abdominal assessment, the nurse follows a specific sequence of techniques. Which sequence is correct for abdominal assessment? Option A: inspection, palpation, percussion, auscultation. Option B: inspection, auscultation, percussion, palpation. Option C: auscultation, inspection, palpation, percussion. Option D: palpation, inspection, auscultation, percussion. The correct answer is B. The abdominal assessment sequence differs from other body systems. Inspection is performed first, followed by auscultation before percussion and palpation. This order prevents altering bowel sounds through physical manipulation of the abdomen. Question 33. The nurse is measuring an adult client's pulse rate. Which pulse site is most commonly used for routine vital sign measurement? Option A: carotid. Option B: femoral. Option C: radial. Option D: apical. The correct answer is C. The radial pulse is the most commonly used site for routine pulse measurement in adults because it is easily accessible, located at the wrist, and provides an accurate assessment of peripheral circulation. Normal adult pulse rate is 60 to 100 beats per minute. Question 34. A 52-year-old client presents for a routine checkup. The nurse measures the client's blood pressure as 134/86 mmHg. Based on current guidelines, how should the nurse classify this blood pressure reading? Option A: normal. Option B: elevated. Option C: stage 1 hypertension. Option D: stage 2 hypertension. The correct answer is C. According to current guidelines, stage 1 hypertension is defined as systolic blood pressure of 130 to 139 millimeters of mercury or diastolic blood pressure of 80 to 89 millimeters of mercury. This client's reading of 134/86 mmHg meets the criteria for stage 1 hypertension in both systolic and diastolic measurements. Question 35. The nurse is performing a comprehensive head-to-toe physical assessment on an adult client. After completing the neurological assessment, which body system should the nurse assess next? Option A, cardiovascular. Option B, respiratory. Option C, hint, head, eyes, ears, nose, throat. Option D, abdominal. The correct answer is C. The standard head-to-toe assessment order follows a logical progression from head downward. After neurological assessment, mental status, cranial nerves, pupils, reflexes, the nurse proceeds to hint examination. This allows systematic evaluation before moving to cardiovascular, respiratory, abdominal, musculoskeletal, and skin systems. Question 36. The nurse is assessing respirations for a 68-year-old client who was recently diagnosed with chronic obstructive pulmonary disease, COPD. The nurse observes that the client's breathing pattern appears irregular. What is the most appropriate action? Option A, count respirations for 15 seconds and multiply by 4. Option B, count respirations for 30 seconds and multiply by 2. Option C, count respirations for a full 60 seconds. Option D, estimate respirations based on the client's general appearance. The correct answer is C. When respirations are irregular, the nurse should count for a full minute, 60 seconds, to obtain an accurate respiratory rate. Normal adult respiratory rate is 12 to 20 breaths per minute. Irregular patterns require longer counting periods to capture the true average and identify patterns such as apnea or irregular rhythms. Question 37. During a head-to-toe assessment, the nurse is evaluating the cardiovascular system. While auscultating heart sounds, the nurse hears a lub-dub rhythm. How should the nurse interpret these sounds? Option A, S1 and S2, indicating normal heart sounds. Option B, S3 and S4, indicating normal heart sounds. Option C, S1 and S2, indicating possible heart failure. Option D, murmurs indicating valvular dysfunction. The correct answer is A. The lub sound corresponds to S1, closure of the mitral and tricuspid valves, and the dub sound corresponds to S2, closure of the aortic and pulmonic valves. Hearing a clear lub-dub rhythm indicates normal heart sounds. S3 and S4 are abnormal sounds that may indicate pathology, such as heart failure or decreased compliance. Question 38. A 72-year-old client reports feeling dizzy when standing up quickly. The nurse suspects orthostatic hypotension and plans to assess for orthostatic blood pressure changes. Which sequence and criteria should the nurse use to perform this assessment correctly? Option A, measure blood pressure lying down and then immediately after standing. A drop of 10 millimeters of mercury in systolic pressure indicates orthostatic hypotension. Option B, measure blood pressure in the following sequence: lying, sitting, and then standing. A drop of 20 millimeters of mercury systolic or 10 millimeters of mercury diastolic with symptoms indicates orthostatic hypotension. Option C, measure blood pressure standing first, then lying down. A difference of more than 15 millimeters of mercury indicates dehydration. Option D, measure blood pressure sitting only, compare to the client's baseline to determine orthostatic changes. The correct answer is B. Orthostatic blood pressure is measured in a sequential manner, first lying down, then sitting, and finally standing, with measurements taken 1 to 3 minutes after position changes. A drop of 20 millimeters of mercury or more in systolic pressure or 10 millimeters of mercury or more in diastolic pressure, accompanied by symptoms such as dizziness, indicates orthostatic hypotension. Question 39. The nurse is preparing to perform a comprehensive physical assessment on a 45-year-old client admitted with abdominal pain. The nurse begins by inspecting the abdomen, noting a slightly distended contour. When proceeding with the assessment, the nurse auscultates bowel sounds in all 4 quadrants before palpating the abdomen. Which statement best explains the rationale for this assessment sequence? Option A. Palpation before auscultation enhances the nurse's ability to detect bowel sounds more accurately. Option B. Auscultation before palpation prevents the nurse from altering bowel sounds and provides more accurate baseline data. Option C. The sequence does not matter as long as all assessment techniques are performed. Option D. Percussion should always be the first technique used when assessing the abdomen. The correct answer is B. In abdominal assessment, auscultation must precede percussion and palpation because touching the abdomen can stimulate peristalsis and alter bowel sounds. This would result in false findings, potentially masking abnormal hypoactive or hyperactive bowel sounds. The correct sequence is inspection, auscultation, percussion, and finally palpation. Question 40. A nurse is caring for a 58-year-old client recovering from thoracic surgery. The nurse assesses the client's oxygen saturation using pulse oximetry and obtains a reading of 88% on room air. The client is alert and oriented but reports mild shortness of breath. Which interpretation and action should the nurse prioritize? Option A. The reading is within normal limits. Continue routine monitoring. Option B. The reading indicates hypoxemia. Immediately notify the healthcare provider and prepare for oxygen supplementation. Option C. The reading is inaccurate due to the client's position. Reposition and reassess without intervention. Option D. The reading indicates mild hypoxia. Encourage deep breathing exercises and reassess in 30 minutes. The correct answer is B. Normal oxygen saturation is 95 to 100%. A reading of 88% indicates hypoxemia, SpO2 below 90%, which requires immediate intervention. This is particularly critical in a post-thoracic surgery client who is at risk for respiratory complications. The nurse should notify the healthcare provider, prepare for oxygen supplementation, and continue monitoring the client closely. Question 41. Which age-related change is considered a normal part of the aging process affecting the sensory system? Option A. Complete hearing loss requiring cochlear implants. Option B. Decreased visual acuity for near objects, presbyopia. Option C. Total loss of taste sensation. Option D. Increased sensitivity to high-pitched sounds. The correct answer is B. Presbyopia is a normal age-related change where the lens loses elasticity, causing difficulty focusing on near objects. This typically begins around age 40 and progressively worsens. It is a universal part of aging and correctable with reading glasses. Question 42. Which assessment tool is specifically designed to screen for cognitive impairment in older adults and can be administered in approximately 2 to 3 minutes? Option A. CATS ADL Index. Option B. Minicog. Option C. Geriatric Depression Scale. Option D. Morse-Fall Scale. The correct answer is B. The Minicog is a brief cognitive screening tool that takes 2 to 3 minutes to administer. It consists of a 3-item recall and clock drawing test. It is highly effective for detecting dementia and does not require language fluency or educational background. Question 43. Which medication class is most likely to contribute to fall risk in older adults due to its effects on blood pressure regulation? Option A, antibiotics. Option B, antihistamines. Option C, antihypertensives. Option D, anticoagulants. The correct answer is C. Antihypertensive medications can cause orthostatic hypotension, leading to dizziness and falls when older adults change positions. This is especially problematic during dose adjustments or when combined with other medications affecting blood pressure. Question 44. A 78-year-old patient is prescribed a new medication. The nurse explains that older adults require lower starting doses. The patient asks why this is necessary. Which response best explains the rationale? Option A, your body has more fat tissue, which makes medications work faster. Option B, your liver processes medications more quickly as you age. Option C, your kidneys clear medications more slowly, so drugs stay in your system longer. Option D, your body has more water, which dilutes medications and requires higher doses. The correct answer is C. Renal function declines with age, resulting in reduced drug clearance. Medications remain in the body longer, increasing the risk of toxicity. The principle start low, go slow accounts for this pharmacokinetic change in older adults. Question 45. A nurse uses the timed up and go (TUG) test to assess an 82-year-old patient. The patient completes the test in 18 seconds. How should the nurse interpret this finding? Option A, the patient has normal mobility with no fall risk. Option B, the patient demonstrates impaired balance requiring further evaluation. Option C, the patient requires immediate physical therapy referral for gait training. Option D, the patient's score indicates severe cognitive impairment. The correct answer is B. A TUG test time greater than 12 seconds indicates increased fall risk. A time of 18 seconds suggests significant balance and mobility impairment that warrants further assessment and intervention planning. The TUG assesses functional mobility, not cognition. Question 46. An 85-year-old patient with a history of falls is being discharged home. Which intervention should the nurse prioritize to reduce the patient's fall risk? Option A, encourage the patient to walk barefoot at home for better floor contact. Option B, install night lights in the hallway and bathroom. Option C, recommend using a wheelchair for all mobility to prevent falls. Option D, advise limiting fluid intake to reduce nighttime bathroom trips. The correct answer is B. Environmental modifications, such as nightlights, address a modifiable fall risk factor, poor lighting during nighttime trips to the bathroom. This intervention maintains patient independence while reducing risk. Visual impairment combined with darkness significantly increases fall risk. Question 47. A 76-year-old patient is prescribed diazepam for anxiety. Which consideration is most important for the nurse to address with the prescriber? Option A, the medication may cause increased energy and insomnia. Option B, the medication is on the Beers criteria list as potentially inappropriate for older adults. Option C, the patient should take the medication on an empty stomach. Option D, the medication is safe because older adults metabolize benzodiazepines faster. The correct answer is B. The Beers criteria identifies medications that pose significant risks for older adults. Benzodiazepines like diazepam increase fall risk, cognitive impairment, and delirium in older adults. The nurse should advocate for alternative treatments with better safety profiles. Question 48. An 80-year-old woman is admitted after falling at home. She lives alone, takes 6 different medications daily, and has not been eating well. Assessment reveals she can dress and feed herself, but cannot manage her finances or medications correctly. Which assessment tool would best identify her need for additional support services? Option A, Morse-Fall Scale. Option B, Katz ADL Index. Option C, Lawton IADL Scale. Option D, Mini-Cog. The correct answer is C. The Lawton Instrumental Activities of Daily Living (IDL) scale assesses complex daily tasks required for independent living, including managing finances, medications, shopping, and meal preparation. The patient's inability to manage finances and medications indicates IDL impairment requiring support services. Question 49. An 83-year-old man with hypertension, diabetes, and osteoarthritis fell twice in the past month. His medications include metoprolol 50 mg twice daily, glipizide 10 mg daily, and ibuprofen 400 mg 3 times daily. He reports dizziness when standing and sometimes skips breakfast. Assessment reveals unsteady gait and visual acuity of 20/50ths. Which factor is most likely contributing to his fall risk? Option A, metoprolol causing orthostatic hypotension. Option B, glipizide causing weight gain. Option C, ibuprofen improving joint mobility. Option D, diabetes causing improved circulation. The correct answer is A. Metoprolol is a beta blocker and antihypertensive that can cause orthostatic hypotension. The patient reports dizziness when standing, a classic sign of orthostatic hypotension. Combined with his unsteady gait, visual impairment, and skipped meals, this creates multiple fall risk factors. Question 50. A home health nurse visits a 79-year-old woman who appears withdrawn and has lost 15 pounds in 3 months. She has unexplained bruising on her arm and tells the nurse, "My son handles my money now, and I don't have enough for groceries." The son is present during the visit and answers questions for her. Which nursing action is the priority? Option A, complete a comprehensive fall risk assessment. Option B, screen the patient for elder abuse using validated tools. Option C, provide education on proper nutrition for older adults. Option D, discuss the need for a financial power of attorney. The correct answer is B. The patient exhibits multiple warning signs of elder abuse, unexplained bruising, physical abuse, financial control with inadequate resources, financial abuse, withdrawal and weight loss, neglect, and the son speaking for her. Potential isolation/coercion. Elder abuse screening is the priority intervention for patient safety.